a little unwell, I know. Right now you can't tell.
Hey everybody, happy Sunday. This is Jess. This week on GenderqueerChat, we're talking about the DSM, and in particular, revisions in gender identity disorder from the DSM 4 to the DSM 5. There's a lot to talk about, so I brought my notes today. The main changes are, one, the name. They're deciding to change the name of the condition from gender identity disorder to gender incongruence. It seems like the main focus is to take the word disorder out of the name, but as others have pointed out, it's still in a book of mental disorders. The diagnosis criteria are less binary. They've removed stereotypical language like rough and tumble play. They've incorporated the use of the term alternative gender to give another option for people who don't necessarily identify with the binary. However, the diagnosis criteria are still heavily relying on people not identifying with their own primary and secondary sex characteristics and wanting the primary and secondary sex characteristics of the opposite gender. Now there's an exit clause, so people are able to eventually stop being diagnosed as having gender incongruence once they follow whatever steps they choose to in order to feel more like their mind and body are in line. However, whenever I read that section in the rationale, they chose to specifically mention transgender individuals who regret transition and would prefer to return to their original assigned gender, and that those people would then be re-diagnosed with GI. I thought it was important that they mentioned that because I think that regret, or the idea of someone regretting transition, is used as a justification for how strict the guidelines are in allowing people to transition. So the fact that they would specifically mention such a case in the DSM rationale was kind of telling to me. Another change, the diagnosis is now separated from distress and impairment, which I think is a positive. It means that you don't have to be like horribly unhappy in order for you to be diagnosed with having gender incongruence, as opposed to gender identity disorder where it had to be seriously affecting your life and your ability to function in order for you to obtain that diagnosis. One thing that I also thought was a positive is that they recognize that increased psychiatric problems in trans people were very heavily linked to increased experiences of stigma. Therefore, a lot of psychological problems that trans people do have aren't innate, they're societal. Well, I think that's a pretty decent summary of the proposed changes from DSM 4 to DSM 5 in gender identity / gender incongruence. But now I think it's time for a costume change. Hi again. So this is how I usually dress when I go to work, but I'm dressed this way today to illustrate that all of us have some deconstruction work to do. I was thinking about why gender identity disorder or gender incongruence are included in the DSM. And I was trying to draw some parallel examples in order to help me understand it better. So I was thinking about GI or GID versus homosexuality, because homosexuality used to be in the DSM and it was removed. The main difference that I see is that homosexuality no longer has a recognized treatment, whereas gender identity, gender incongruence can be treated with hormones, surgery, other physical methods, I suppose. As far as psychological treatments, I think that therapy can be helpful with both gender identity and with homosexuality, but only because they're both very stigmatized things in which society is unsupportive. So it's usually for societal reasons that people need help coping with and dealing with these issues, not really innate internal reasons. And then as far as surgery, one of the treatments for gender identity disorder, I was thinking about specifically surgery on primary and secondary sexual characteristics and seeing if I could think of parallel examples there. Precedents I could think of were reconstructive surgery for breast cancer patients. Now, if someone's insurance pays for them to have a mastectomy because they have breast cancer, it also has to pay for them to have reconstructive surgery. I think that's really great and important, but I also think that it sets the precedent that breasts, or the lack thereof, are fundamental to someone's gender identity. They're not just lumps of flesh on someone's chest. So I think that could be a positive precedent for the trans community. Other surgeries, cosmetic breast or pec implants in order to improve someone's self-image. And then as far as lower surgeries, genetic women could have vaginal rejuvenation surgery now, or genetic men could have penile enlargement surgery, and neither of these things require a note from a doctor. I was thinking about hormones and hormone usage in non-transgender situations. Testosterone is given as a treatment for hypogonadism, infertility, lack of libido in both men and women, osteoporosis, low energy, and it's used by athletes, though usually not completely legally. Estrogen is used as a contraceptive, as HRT for postmenopausal women, and is heavily prescribed for menstrual irregularities. Myself a case in point, I know they hand that stuff out like candy. As far as how hormones are regulated in non-transgender situations, they still require medical authorization, but not a psychiatric authorization as they do whenever dealing with cases of gender identity disorder. So examining all these different parallel situations, I got one big glaring arrow pointing at one of my very favorite forms of oppression. Yes, sexism. Many of us realize that we live in a society that heavily relies on sex and gender to oppress some and elevate others. I want to take the time to say that I think that both male and female-bodied people are equally affected by this form of oppression. While I was examining these parallel situations, it became very clear to me that surgery and hormones are readily available whenever their use is upholding the status quo. However, they are tightly controlled whenever people are trying to subvert the status quo. I think that crossing gender lines, and even more so blurring them, acts to threaten this social institution. I mean, for God's sakes, if people are switching genders and living in between them, how are we supposed to know who we're supposed to oppress and how we're supposed to oppress them? A lot of people say that GID or GI should be included in the DSM for insurance purposes. And while that may be true for people who are seeking therapy because of societal oppression around their gender identity, as far as physical transition goes, please correct me if I'm wrong, but I feel like the majority of people are paying all those expenses out of their own pockets. I guess the gatekeeper system of access to trans physical health care would make more sense to me if insurance was actually covering these procedures and hormone treatments. But since trans people are paying for these things mostly out of their pockets, it seems to me like a power structure just for the sake of a power structure. One issue that did strike me in our discussion of GID or GI being included in the DSM was people's idea about stigma and not wanting to be associated with people with mental disorders. Personally, I don't think this is an awesome reason to remove GID or GI from the DSM. Many other disorders in the DSM have physical or physiological roots or causes, such as chemical or hormonal imbalances, etc. I personally have a diagnosis in the DSM for my major depressive disorder, and I have experienced stigma based on my mental health status. I think a healthier approach for the trans and genderqueer community might be to help destigmatize mental health issues instead of distancing themselves from them. The situation is really reminiscent to me of how the G and L distance themselves from the B and T, and how the HRC crowd distance themselves from any non-conforming queer people. It would be useful to recognize that people with mental health disorders aren't those people, that some of those people are us as well. I'm just sick of seeing people throw other people under the bus. I think we all have way too many tire tracks on our backs as it is. Have an excellent week, and I'll catch you next time. I'm bionic.